The Department of Veteran Affairs has, over the last maybe 5 to 10 years, really been trying to come back and correct some of the lack of standards in healthcare. So I had a emergency and went to a VA emergency room in 2013. In 2013, at the Washington D.C. VA hospital, there was not one bed that was a female bed, or a bed that had the stirrups that you would use for a woman that was having a challenge or an issue. We turned a nurse. Thank God for nurses. Thank God for nurses. Because if we ever had to depend on doctors to figure things out, we'd be in trouble. Thank God for nurses. A nurse turned a bedpan upside down and propped that under me, and we made a makeshift thing. But that was in 2013. In 2013, there were no female beds at an emergency room in Washington, D.C. that's supposed to treat all veterans, male and female. So I think, and prior to me, I obviously wasn't the first person that had that issue, but women really, they would have these issues or challenges. They would never file a complaint. They would never talk about it. Henceforth, the correction of that could never happen. But then you have someone like me who comes along, and I put this in writing and say, this should not be an experience for a veteran who's having an emergency in Washington, D.C., and you don't have one bed that's made for a woman. What they said, typically, if a woman had, at that hospital, they told me, the nurse said, when women show up and they have issues or challenges, they put them in an ambulance and send them over to a local hospital. So, but now we have the VA is coming out, and they're now creating these, and they're very effective, and thank God that they're doing it. And I'm not going to say it's too little, it's too late. We can't go back and erase history. We can't go back and say, oh, but you didn't do. I don't care what you didn't do. I'm concerned that you have addressed it. You know that it's an issue, and you're making some steps to make it better. And so what they're doing is they're creating these wonderful women health centers now at certain hospitals and certain VA clinics, where you show up and it's it's a female team, or it's a team of individuals who are geared with treating and addressing the issues of the woman veteran. So in some of the facilities, they have private rooms or a private area for them to check in. At other hospitals or locations, it's an entire location. So everyone there is going to be for the woman veteran. It just depends on where you live and the number of women veterans that are representative in that VISN. The VISN is the areas that are that treat VA. So a VISN contains both clinics and hospitals and other medical centers, and they cover pretty large, substantial parts of areas. So we have the VA coming back to make some corrections of things that haven't been right. Obviously, we're not totally there, but they are making some strides.